This whole root cause thing is not that complicated. Cause number one is external pathogens, infections, and toxicity. I used to run a stool analysis on every patient with a chronic condition, and we'd find parasites, bacteria, yeast. I'd give them herbs that release the exterior, eliminate toxins and infections, and we'd retest in a few months, and most of the time the infections were gone. Sometimes we had to try again. Very few times though. And the person felt a whole lot better when that lab test was normalized. Every single time. Very few people with chronic conditions did not have some external pathogen to eliminate. Now I just look at the immune cells on your blood work and prescribe to support what your immune system is prioritizing. For example, if your lymphocytes are elevated, I'll prescribe herbs that support the elimination of viruses. How effective is it? Well, most of my patients were desperate. They could not live with their symptoms, and they were willing to try anything for relief. And most of them didn't have much hope left when they met me. More than one person described the feeling of life slipping away from them, and way more often than not, their health was completely restored. I wrote up about 50 of the more complicated, complex patient stories as case studies, with diagnosis, what we did for treatment, and the results, including how long it took, on my website.